So the next question we get a lot is what's actually happening in the playroom? How does it work? The mechanism of change, especially for younger kiddos, maybe age 2 to 8, is generally focused on non directive play therapy. So the research tells us that for this age, the best way for kids to process is through play. It's their first language. If you think about how kids learn, like, do I exist? Like, what's actually here? It's through peekaboo or hide and seek. Kids learn through play. And I think as adults, we often want our children to talk about it so that we can fully understand. But again, the research tells us the best way for kids to process and learn and grow is through playing it out. So if they're experiencing intensity, anxiety, fear, anger, we'll learn a lot more and actually be able to help them in learning new skills if they can play it out with characters and playing with the therapist through board games. And then the therapist can intervene after the child feels comfortable and safe and offer new and more effective ways for them to work with whatever that big emotion is. So if the child is being a little bit aggressive or rather anxious, the therapist might say, this totally works, but what if we took a breath, or what if we tried in a way that the other character could actually understand and like not get upset themselves. So we increase awareness, we support emotional regulation skills, we support confidence building through the play. And because our therapists also have training in synergetic play therapy, which also takes into account nervous system regulation and the body, we're paying attention to how the child is feeling in their body and what kind of tools they can use to regulate on a nervous system level. So it's a little bit abstract for some parents to understand, but know that we really have vetted what are the most research based ways for children to actually grow and heal. And a lot of that is through play. And we see a ton of success in kids moving towards whatever goal their parent has in mind for them, whether that's staying in their bed at night, potty training, feeling more confident, less anxious, having more success socially, whatever it is, the play therapy is just an incredible way for them to grow and process. We absolutely, especially with older kids, will go a little bit what's called directive, a little bit more directive. So we may ask questions, we may make lists of coping tools. It's more of a cognitive behavioral approach where we're connecting for kids the link between their thoughts, their feelings, and their behaviors. But at the root of everything that we do is just supporting kids in creating a really safe and authentic connection with their therapists. In meta analyses of all the different therapy approaches, it has been found that more than the approach or what therapy tool is being used, the number one indicator of successful treatment is positive rapport between the client and the therapist. So there being a really strong therapeutic alliance. Our therapists are trained to prioritize creating that with kiddos and helping children move at their own pace to build trust with their therapists. And then from there, we can access the deeper layers of what might be stuck and what might be at the root of some of the behaviors. So while it may be easier in some ways to just focus on a behavior plan and shifting behaviors um, from the top down, we can offer some of that. We do with parents sometimes offer more directive behavior plans that you might use at home, but our process creates more of a deeper healing. So from the bottom up, we're looking at what is preventing this child from feeling safe in their world and secure, and using the most like positive and adaptive coping strategies possible to handle challenge. And our therapists will support kids in literally building those muscles, modeling like how they might approach challenge in a way that's more effective, helping them process any life experiences that feel big or stuck and are preventing them from feeling fully safe, and then communicating to parents, here's what's going on with your kiddo, here's how you can support them even further at home. So the therapy in itself, whether that's with younger kids, the slightly more non-directive, it gets a little bit directive. The therapy in itself is healing. And I actually used to offer these modalities in our approach in school-based care where I wasn't working with parents at all. I just saw kids were pulled out of classrooms and came to their therapy sessions, and there was a ton of success. But what Root of Rhythm adds in is a very strong focus on also connecting with parents. So, in addition to your child healing and growing through these modalities in the therapy in the playroom, parents are also getting a lot of support individualized to what's happening for their child so that you can keep supporting them at home and then ultimately be that long-term attachment figure that will support them. And then lastly, I think that our therapy approach just provides a really spacious, consistent space where kids can come to the same toys, the same space, the same therapist, hopefully at the same time each week, and start to have a place where they can really grow towards healing. We understand that it's a massive deal to choose a therapist and approach for your child, and we want to make sure that our approach feels right for you. This is just a little intro. If you explore our site, you'll get a lot more information on how we're approaching supporting children. And then, of course, we'll chat with you individually in your consultation.